Good morning, everybody. It's Dr. Bruce Guillory here with Health Source Chiropractic in Atascocita, Texas, coming to you on Thursday morning, June the 11th. And let me just say that if you're here in Southeast Texas right now and you have not been outside yet, you are in for a surprise. It's June 11th. It should not be 65 degrees outside with like zero humidity, but that's what it is right now. So if you've not gotten out to enjoy it, please go do that. Get out this evening and go for a walk because it should be a really nice evening again. Tomorrow morning should be nice. Enjoy it while we can because the humidity's coming back sometime over the weekend. It's going to start creeping back in. So be aware of that. I went out this morning and it was 65 degrees and no humidity. It was a phenomenal time to be walking. It was great. Please take advantage of it. Get out and move well, right? Because we know that July and August are just around the corner, and we know what that means here in Houston, Texas. It means it might just be a little bit toasty for an extended period of time, as we are pretty aware of around here. So anyway, go out and enjoy the weather. Have a great day today. It was really great to be able to enjoy something beautiful like that, considering the immense amount of bad news that we get exposed to on a regular basis these days. Everything from coronavirus to the economy to the protests, all those sort of things. It's hard. It's a challenging time. So go get out and have a little fun. Enjoy this weather. Get your kids outside. Do what you can to soak up the weather. So we're going to talk a little bit about some serious stuff here, some concerning stuff. We here at Health Source are aware that numbers of COVID infections in Harris County are rising. It's been written up in news publications. We are aware that hospitalizations are rising. That has been documented as well. And yeah, I do understand, before we go any further, that potentially some of our news organizations might have reasons to report things certain ways. And I'm not pointing out one side versus the other because we're not going to talk politics here. That's not what this is about. But in general, unfortunately, that's the way news is done a lot of times. Unlike a couple of generations ago. So we do have to just know that there are facts that numbers are increasing. And so that can scare people. But we also need to understand this. When we begin opening the economy as we have over the past month, that is just automatically going to cause some increase in numbers. Now, that being said, let me tell you, as a healthcare provider and a guy who has spent dozens upon dozens of hours reading and researching on this since January of this year, because I have a responsibility to my patients and to my community. I need to be abreast of everything. I want you to understand that I knew this was coming, and we just need to make sure that we do the necessary things to ensure that we slow the spread down once again. So let me encourage you, please avoid large groups of people. We're not going to talk anything political. Do your part. Avoid large groups of people. Very simple. Yes, this is a controversial thing that I'm about to say here. I would encourage you out in the public to mask up. I have read and researched dozens upon dozens of articles on this. I mask up when I go out in public. I do. And I strongly encourage other people to do that as well. If you want to have that conversation with me about why, we can do that. I'm not going to do it on this video here, but I'm just going to encourage you. I think we probably ought to be doing that to a certain degree. That's enough about that. I'm going to say this about our office. We've added in a couple of new protocols at the office to make sure we keep everyone safe. One, we are still continuing to keep our door locked and not just allow people to wander in, haphazardly. We want to limit the number of exposures we have within our office, person to person. So we're going to continue doing that. Along those lines, we have had to, as our practice has gotten back to normal numbers and very busy, in fact, at times, if you've been around us recently, we are going to ask you to not bring any guests with you. Now, if you're bringing in a minor for treatment, then one parent can come in with them. But please, no more guests in the office right now. We need to keep our person-to-person exposure minimalized for our patients so they can get the care they need and that they're looking for in a safe way. We're looking out for you here. We as a team will continue to wear our masks. We are not going to mandate masks in our office, but I'm going to strongly encourage you that if you're coming in to see us, please consider, for the health of our patients and our family and for our health, your staff here, your health source team, please consider wearing a face mask. We're not going to turn you away if you don't. I'm not going to do that. Okay, because I don't want to get into that argument. Don't want to get into that discussion because I know it's controversial in some people's eyes. But I'm going to tell you, we're asking you to consider doing it. And so please do that. We would appreciate it if you do. We are doing everything we can to make sure you're safe. We would ask a return favor and that is to consider wearing a mask when you come into our office. All right. Okay. So there we go. Let's talk about a couple of things here. Let me give you some encouraging news. You oftentimes, and I talked about this on my Facebook Live today from the bridge where I was walking across this morning. If you saw it, but I want to. If you didn't see it, here you go. I want you to take the concept of a sick day, and I want you to flip it. Okay. I want you to flip that script. I want you to start thinking about taking a wellness day. That sounds weird, doesn't it? Yeah, I agree. Here's what I want you to do. I'm not saying skip work and say you're, well, I'm not coming in. That's not what I'm talking about here. What I'm talking about is creating, be, begin to create the basis for a wellness lifestyle by having a wellness day. One day, one day. It's all it takes. Here's what you got to do. Remember our 4 pillars of wellness here: eat well, move well, think well, rest well. Okay, so how do we do this? Number one, you could do it today if you're ready. But some of you may look at your refrigerator and go, man, I got frozen dinners and I got pasta and I got, whatever, pizza and that kind of stuff in there. That's not necessarily stuff that we want to use to nourish our body in a wellness way. So you might have to plan a little bit. And this is what I'm going to suggest. Make sure you plan it. Plan your wellness day ahead of time. He who fails to plan is planning to fail. So today, start planning what day you're going to do it and how are you going to do it. What are you going to eat that day? You're looking for some healthy recipes? Man, get on our Facebook page, Health Source Chiropractic of Atascocita. Skim through there. You're going to see some great healthy recipes. There will be a recipe of the week tagged on to. If you're receiving this video via our email, you will also be receiving a healthy recipe of the week too. But if you go to our Facebook page, you'll see a bunch of those on there as well. Hey, if you're not seeing this via email, if you're seeing this via Twitter or Facebook or something of that nature, contact our office and let's get you on our email list so you can get some great updates on a regular basis. Okay. All right. If you don't like our email, then you can kind of go, please quit sending me this, and then you'll get cut off the list. It'll be okay. All right. We won't be offended if you do that. But anyway, plan out your meals. What are you going to have for breakfast? What are you going to have for lunch? What are you going to have for dinner? Are you going to have some healthy snacks too? What are you going to be drinking that day? What are you going to, how much water are you going to consume, right? Remember to focus on eating whole, real foods as much as possible. Avoid processed foods. Avoid anything that didn't used to grow on a plant or didn't used to have eyes. And so do that. Okay. So eat well, move well, plan out how you're going to spend some time with some intentional exercise, but also, as you may have heard me preaching in the past, plan some time to move regularly throughout the day. Get up and move. Don't sit on your backside all day long because that's not part of a wellness day. Okay, get up and move on a regular basis. You need help doing that? Give us a shout. Eat well, move well, think well. Boy, right now it is so easy to think poorly because we're exposed to so much stuff here on the internet, on the news channels, whatever it may be, because of coronavirus and all those things I mentioned early on in this video. And it's filling your mind with junk food for your mind. So commit to getting off of the internet for a day. That scares some of you, I understand that. And filling your mind with great stuff. Okay, you can use the internet actually to find great stuff. You can follow some great videos or look at some great inspiring videos, some great reading online. You can read a great book. If you need some help with any of that, let me know. Again, we can help you with that kind of stuff. There are people that I follow online that provide great information that inspire me to do better and to optimize my life and to tweak the things that I do in my life on a regular basis to become a better version of me. All right, so fill your mind with that kind of stuff. Eat well, move well, think well, rest well. Plan to be on bed at a decent hour and to sleep a certain amount of time that night. Go get online and learn how to get online and learn how to create good sleep hygiene habits and start practicing those. Now, if you've completed one wellness day, attaboy, attagirl, it's good. Pat yourself on the back, man. You deserve that. Start stringing some of those together. Yeah, and you do that a little bit at a time, and you've got a wellness lifestyle going on. How about that? Now, it's not something that just happens automatically. You got to keep tweaking and keep refining what you're doing and optimizing your lifestyle, because you're going to have a tendency to do, like me included, backslide, to use an old Baptist term there, backslide into a lifestyle that maybe isn't quite as healthy, right? So stay on top of that. Stay tuned into the things that we put on our Facebook page, or we put on our YouTube channel, or we put onto Twitter or Instagram. Use those tools as good, positive resources to support you in your quest for wellness and your journey toward wellness. Okay? All right, so that's about it for today. Again, if you're receiving this via email, don't forget there's going to be a healthy recipe of the week also on this email. Try it out and give us a shout if you've done it, and let us know how you liked it. Okay? Let us know how you liked it, and if you made some changes to it too. Talk to us about that. We'd love to share that with the rest of our community. We're going to be in to see patients this afternoon from 2:30 until 6, so call us at 281-852-5600 if you need to get in. You guys have an amazing Thursday. Enjoy this weather if you're in my neck of the woods, and we'll speak to you guys again real soon. Take care now.